On this edition of the Best Docs Network featuring Forest Park Medical Center, we'll meet plastic surgeon Dr. Jeff Angobaldo, ENT and facial plastic surgeon Dr. Colin Pero, ENT Dr. Robert Wyatt, OBGYN Dr. Nicholas Lux. Hi again, everyone. I'm Candace Kruger along with Jim Knox, and we're back again with another edition of the Best Docs Network featuring Forest Park Medical Center. Of course, Forest Park Medical Center is one of the best medical centers in all of the Dallas-Fort Worth area.
Exactly right, Candace. This is the place to be, and we're going to start off the show with one doctor who operates right here out of beautiful Forest Park Medical Center, who helped one lady breathe a little easier. It's Dr. Colin Pero.
For the last couple of years, I started having nosebleeds. They were never very severe. I went to the doctor a couple of times. We couldn't really figure out what was causing them. And then about 4 months ago, they became terribly severe and would last a half an hour at a time. And so I went to my internist who had me do an MRI and said, well, the good news is you have no tumor, but the bad news is you are not formed correctly. So that's when he sent me to Dr. Pero.
One of the newer technologies that we have over the last few years to help people with not only nasal obstruction but with sinus infections and sinus problems is balloon sinuplasty. And balloon sinuplasty has been an excellent advancement in that it is a relatively less invasive or non-invasive technique to help open up the sinuses.
I think I had just a congenital issue, and he said, I really want you to come look at your MRI. I said, but I have just a vessel, I want you to cauterize. And he goes, no, that's really not it. And so I looked at the MRI and it all made sense because I've never been able to blow my nose on the left side. Well, it's because that left side was almost completely closed.
The way balloon sinuplasty works is if you have a sinus opening that is narrowed and usually congenitally, in other words, people were born that way, and then if they have a little bit of swelling, say in response to a cold or even a weather change or allergies, if you have a narrow opening, if it swells a little bit, it can swell shut. By placing a balloon into the sinus opening, we're able to inflate that opening and make that opening larger. If you then get the same amount of swelling from the allergies or cold or what have you, it's no longer swelling shut anymore and the sinus can continue to function as normal.
Dr. Pero told me that he would go in and open up the left sinus cavity where it would actually drain properly and I could breathe through the left side. It was just so successful. It was shocking when I went for my follow-up visit and he took the packing out and said, okay, breathe through your nose. And I did, and it almost felt like I had too much oxygen. It's a huge difference. Dr. Pero is wonderful, and I would recommend him to anyone.
Radiology departments are very commonly in hospitals. The difference here is that this is primarily a surgical hospital, and our primary purpose is to support our OR. And we've got 14 OR suites upstairs. We have both pre and post-operative imaging.
Here at Forest Park, I work more closely with the staff members, kind of the segue between the director and the technologist. I'm here with them daily, supervising what rooms they're in, what exams need to be done, what tech goes to what assignment.
We're a full-service outpatient facility. We have an MRI here that's called a short bore. What that means is it's not as coffin-like for patients. It's more open. We also have a CT scanner here. It's a 64 slice that is capable of doing cardiac as well as any other CT imaging that you might need. And it's also an interventional radiology CT scanner, meaning we can do procedures that normally would have had to been done in another room and then brought to CT for scanning. We can do both on the scanner at the same time. We have an on-site radiologist from RCA that read all our imaging. We have an on-site ultrasound unit fully capable of doing general ultrasound and vascular, and I also have a staff member that can do both.
Here at Forest Park Medical Center, we work closely with some of the best surgeons in the area. They're definitely top-notch. We do what's best for them, and we make sure that we have all of the equipment necessary, all of the reps that they need to make sure that they get the job done well.
Our surgery suite encompasses 4 C-arms that can be used in a variety of times during the day, and our primary OR tech, who happens to be our lead tech here at this facility, is Stephanie Woodley. And she has not only taken the bull by the horns here at this facility, but she's also trained each of the other staff members that work in OR and has done a phenomenal job in that capacity.
If we're doing spinal fusions, that screw placement is very important. And we need to make sure that those screws go in exactly where they need to be. And imaging has everything to do with that. If our image is wrong, then those screws could be placed incorrectly. So we work very closely with the surgeons to make sure that we have the right image that they need, to make sure that they can place the screws correctly in the spine where they need to be. We're actually imaging during the surgery and assisting the surgeon to make sure that he's guiding his tools into the right, proper anatomy to make sure that he's doing it where he needs to be.
I really firmly believe that we have state-of-the-art equipment here, and I've got a top-notch staff that can really meet any of the referring physicians in the community's needs.
Best Docs Network featuring Forest Park Medical Center. Forest Park Medical Center, extraordinary in every way.
One thing I really love about Forest Park, and I tell everyone that I talk with in my nursing career about Forest Park, I like to talk about the camaraderie that's here. I really enjoy just a positive, energetic setting with the staff. Everyone works quite well together. Inter-department, just, you know, pharmacy, ER, X-ray, the doctors, the nurses. It's just a really cohesive unit, and I really enjoy that. And I feel like every day I come here, I enjoy my day. And that says a lot because nursing can be really stressful. So to be able to come here and feel the support from my teammates and to have a good day at the end of every day is something I really appreciate. I do feel like our administration provides us resources that we need to provide quality patient care. We have the equipment that we need. We have updated, you know, top-of-the-line equipment. We have the supplies necessary to care for our patient population, and then they're always accessible. If they're not, you know, readily available in their office, they have their phones that are always on, and you feel like you can call them with anything that you might need, and that brings another great sense of comfort. I do know that I'm a very fortunate person to have found a career that has provided me such satisfaction and happiness in my life, and I feel every day that I've learned something or I've provided something really excellent to my patient population. I'm really glad that I'm able to do it every day.
Did you know that Forest Park Medical Center is equipped with a high-tech tube system that sends stat lab work from any location in the hospital to the lab? This enables the lab to test samples quickly for better patient care. Today's Ask the Doctor comes from Jessica. She has a question for Dr. Brian Barnett. How does a fertility specialist work in conjunction with OBGYNs?
We work with them on a regular basis. In fact, our 2 biggest referrals are previous patients and the local OBGYN. So it's very common that when women try and start a family, they commonly go to their OBGYN first, and they often initiate some of the workup. And if those patients are not able to conceive through their local OBGYN, through basic treatments or require more advanced treatments, they then refer those patients over to us. But at Dallas IVF, we're a full-service infertility practice. We don't deliver babies anymore. Our goal is to get these couples pregnant in a timely manner, and then they return to their local OBGYNs to initiate their prenatal care.
Before I had a chance to get with Dr. Hahn, I was kind of suffering with allergies pretty severely, whether it be like sneezing or not being able to breathe or not being able to breathe without opening my mouth. And then also every time I would sneeze or have any allergic reaction, anything, it would swell up so severely it just no air could pass through. And so I had gone to multiple allergists my whole life.
Jennifer came to me because she was primarily experiencing nasal obstruction. It had been going on for most of her life. She did not have any clear history of any nasal injury or any accidents in the past, but she found that she was unable to breathe from both sides, but it seemed like her right side was more affected. And after years of medication, and she still wasn't getting the relief, and she still felt like she wasn't breathing as well as she should.
We talked about if I wanted to do rhinoplasty as well, which I ended up doing because I did have a hump, and then they straightened it out, but I also wanted to not let it look like I had had my nose fixed, if you will, and so he just took my bump out and then corrected my septum, which kind of straightened everything up.
The surgery entailed straightening out her septum and shrinking down the turbinate to create more room in both the right and left sides of her nostrils. I also used some of that septum to create some grafts to help support the nose, because part of Jennifer's problem was that the framework of the nose was starting to shift and collapse, contributing to her nasal obstruction. And so I used some of her septum to help re-support the nose.
You can make it as big a deal as you want, but for me personally, my recovery time was nothing. There was only upsides for me.
A lot of people just go through most of their lives really not knowing sort of the potential of how well they can breathe through their nose. It's very hard to sort of be able to mimic with medications or anything like that what it's like to sort of optimally breathe.
It was literally one of the best things I've ever done.
All of the physicians here at Forest Park Medical Center are all about helping to change people's lives. And you know, we talk a lot about breast augmentation, but you don't hear much about breast reduction. But our next best doc, Dr. Jeff Angobaldo, helps one woman with just that.
I had back pain, I had neck and shoulder pain, and my breasts were large, and it made wearing certain styles of clothing just undoable. Over the years, I've gone to physical therapy for my back and neck and shoulder pain, and it would help for a while, and then after a while, it would just go back to the old, same old, same old. And I've taken muscle relaxants, and I would take prescription pain medicine and over-the-counter pain medicines, and it was just not working for me.
Rosetta came to the office for a consultation for breast reduction surgery. She, for her tiny frame, she was very disproportionate. She's always had this, and she's been self-conscious of this since she was a teenager. I believe she was a G or an H, which affected her quality of life. She wasn't able to really engage in too many activities, sports activities, a lot of running or exercise, and she was having a lot of back and neck pain.
I ended up deciding that it was time to do something more permanent to alleviate the situation. And my primary care had recommended Dr. Angobaldo to me. And I went in to see him, and I immediately clicked with him and thought it was a good fit.
Breast reductions can help solve a lot of these symptoms that people are suffering from. Rosetta's surgery took about 4 hours to do, which included liposuction of her lateral breast tissue and her axillary tissue. She has a very nice result. We removed 3 pounds, a little over 3 pounds of breast tissue. Just imagine if you had a heavy gold necklace with 3.5 pounds and you've been carrying it or wearing it for the last 20 years. So just having that reduction in weight was a huge benefit for her, and she felt it immediately.
I'm looking forward to the fashion options that I'll have now, and just looking proportioned, no more pain. I'm just really excited.
Jacob's quality of life was affected due to gastric reflux disease until he met Dr. Glenn Eide. To find out more about Jacob's story and other life-changing stories, log on to bestdocsnetwork.com.
Endometriosis is glandular cells similar to the lining of the uterus that gets where it doesn't belong. It can get on the bowel, the bladder, the uterus, the tubes, the ovaries, in their liver, in their lungs. This is a disease that can get almost anywhere, and it's not a malignancy, it's not cancer, but the symptoms that it produces are so life-interfering that it feels like a life-threatening problem. They can't function, and it grows with hormones. And all of this is related to their immune system. Women are more likely to have lupus, rheumatoid arthritis, hypothyroidism. They have problems with their bladder where they pee a lot during the day and there's blood in the urine. So because of the immune system, this disease continues to grow. They can't eradicate it, they can't get rid of it. And it does grow with their own hormones or even artificial hormones such as birth control pills. How do I know when to go to the doctor? If your symptoms are interfering with your normal functions, that's the time to go see a doctor. If you wake up in the morning with your cycle and it hurts a little bit, and you don't even have to take any medication, maybe you don't need to see a doctor. If you have to take any pain medication, if you have to lay on a heating pad, if you can't go and have fun with your friends or your family and do your normal activities, that's the time to seek help from somebody who deals with endometriosis on a daily basis. The way to cure and get rid of as much endometriosis as you can is actually to cut it out. We outline it and then lift the tissue up and then cut underneath so that we have normal tissue that we take out along with the endometriosis. So by doing this, we eradicate as much endometriosis as we possibly can. Any place where this disease is at, we have to excise it / cut it out so that we give that patient the best opportunity to be as symptom or disease-free as we can. The goal of this is to treat this disease early. If we can treat this disease early, we have a much better success rate in eradicating this disease so that a woman can go on and have a very functional life. And early treatment is key to this.
You know, one of the great things about Forest Park Medical Center is you walk in and it really doesn't feel like a hospital.
You're exactly right, Candace. You know, you walk in a lot of hospitals or medical centers and it feels like a hospital or medical center. At Forest Park Medical Center, it feels like a 5-star hotel.
It really does. The only thing is you never want to leave. As always, if you need more information or would like more information on Forest Park Medical Center, their great facilities, or any of their amazing doctors, just log on to our website, bestdocsnetwork.com, and be sure to click on the Forest Park Medical Center tab.
And speaking of amazing doctors, this next doctor is one of my favorites because he helps individuals with sinus infections. It's Dr. Robert Wyatt.
Well, prior to coming to see Dr. Wyatt, I was constantly clogged, my nose, constantly having to blow my nose. I was carrying toilet paper around with me constantly and was just miserable. I couldn't smell at all, had a hard time tasting, and it really affected my lifestyle.
Jenna has been a patient of mine for a long time now, and she has very serious problems with sinus infections, sinus polyps, allergies, and associated problems with asthma.
I wanted to find out what was going on so I could breathe better and be functional.
She has a lot of problems with chronic sinusitis with the formation of a lot of polyps. It's driven by her allergic disease and underlying inflammation that she has all the time. One of the big problems she has is something I see very commonly where sinus problems are making asthma worse.
He explained to me that I had a lot of polyp development in my nose and that he needed to remove them so that way I could breathe better and that way everything would flow more clearly and I would be able to smell as well.
So one of the things that happens to her when her sinuses start causing trouble is her asthma gets a lot worse. I would never be able to cure her, but I would be able to dramatically improve her quality of life by cutting down on the medicine she had to take all the time, improving her breathing through her nose, her sense of smell.
Dr. Wyatt has changed my life in many ways. First of all, being able to smell my own perfume. Yeah, he's definitely changed my life. I can taste food again. I can make trips with my husband and I I can have a normal life. I love being able to smell flowers.
And she's one of those people, unfortunately, that I have not been able to go in and cure with a single surgery, but because of the minimally invasive techniques that I'm able to employ now, even though she requires surgery to clear out polyps every 18 months to 2 years or so, she's able to get that done and tolerate that with very little downtime.
He is a great doctor. I love that he explains things to me well. He shows me things. He helps me out with new medications if I'm on them. He coordinates really well with other doctors. I just love Dr. Wyatt and his team. I would definitely recommend Dr. Wyatt.
I'm joined now by one of the founders of Forest Park Medical Center and top bariatric surgeon, Dr. Wade Barker. Dr. Barker, thanks for being with us today.
Oh, thank you.
If you would start off by talking to us a little bit about what made you decide to practice medicine and specifically bariatrics.
Medicine is actually kind of a story that started in high school. I really didn't like school to start with. From first grade, I missed school, didn't want to go, and never thought I would go another 13 years after high school. But in high school, the valedictorian was going to be a doctor, and my pride was, well, if he can do that, I can certainly do that. And so it was really a pride thing that got me interested in medicine. And fortunately, I enjoyed the science, I enjoyed, biology and chemistry, and so it just was right down my alley.
And what's the most rewarding part of your job?
Seeing the results for patients and really getting a thank you, in a lot of fields and in medicine in general, that's your job, to take care of the patients and do the things correctly. And so people expect that, but in bariatric medicine, they are so grateful that they always remember to say thank you and tell you not just thank you, but how you've changed their lives.
And in a lot of times, saved their lives.
Realistically, that is true in the short term and in the long term in many cases.
You've obviously been an integral part of the development of Forest Park. How did you come to the vision of Forest Park Medical Centers?
Well, it really started in the OR. Dr. Toussaint and I worked together every day. We worked long hours, and the hours were so long because towards the end of the day, all the hospitals would start sending the nurses home at 3 o'clock, and so we would go from 2 rooms down to 1 room, and it slowed things down. So we would do 8 cases in the first half of the day, and then only be able to do 2 cases or 3 cases in the second half of the day because it slowed down. It just didn't make sense. This is what they did for a living. This is how this was their business, and they were basically shutting us down. So we thought we could do it better. And so it really started as efficiency and being able to do what was best for the patient. If you have a patient that comes in at 10 in the morning for a 1 o'clock surgery and that gets put off till 6, 7 at night because they've shut the OR down, that's not good for anybody. And so it really started from a practical manner.
What do you say to a patient to tell them how much better Forest Park is and why they should have their procedure done here?
I think we do it better. I think we do it more efficiently, and I think the patients have better comfort.
Thank you, Dr. Barker. We appreciate your time.
Thank you, Candace.
And stay tuned as we meet another Forest Park physician that is changing people's lives.
On to our next Forest Park Medical Center doctor. It's Dr. Nicholas Lux, who helped one individual suffering from pelvic pain.
One of the most common problems that a lot of women do not know much about, or a lot of women haven't even heard of it, is a condition called polycystic ovary syndrome. Women who have irregular cycles, or they have a history of missing a lot of cycles, or they have overt pelvic pain, are often found to have this condition.
Before I came to Dr. Lux, I was having a lot of irregular periods, and I couldn't even walk sometimes because my pains were just really, really bad. They were sharp, and just getting around, it was just really hard for me.
Now, in Marley's case, she came in about a year ago with symptoms that are very typical of PCO, and that consisted of irregular cycles and pelvic pain. We did an exam, pelvic sonogram. Turned out that she has polycystic ovaries, and she also had some findings I thought might be typical of some other conditions that can cause pelvic pain, such as endometriosis.
So doctor sent me here and had the sonograms. And then after I had the sonos, and it showed that I did have the polycystic ovaries, which was cysts around my ovaries. I had one big cyst, but then I also had several different little ones too.
Treatment of PCO and pelvic pain consists of a surgical option versus a conservative option. It depends on what your goals are, it depends on the severity of the symptoms. In her case, she was in pain and she wanted to do something about that.
I went in the Thursday before and had the pre-op, and then after I had the pre-op done, they kind of told me, you know, how long I was going to be out of work, and which is I was only out of work a week. I was there probably an hour after the surgery in recovery, and then I was able to go home that same day. If any woman is having pelvic pains, I highly recommend seeing Dr. Lex.
Best Docs Network featuring Forest Park Medical Center. Welcome to the 21st century of cutting-edge medicine. Forest Park Medical Center.
We were going down a back road, and there was a group of dogs that I could see in front of me, but apparently there was one left behind, and it came out of my blind sight, and when I finally saw it, and I swerved, and when I swerved, it slammed me into 2 oak trees.
When Brittany came in to see me, she had a profound hearing loss in that ear from the car accident. Something associated with the accident affected the continuity of the 3 little hearing bones in her middle ear.
When I was in the hospital bed, if I was laying on my left side, my right side I couldn't hear anything. I think there's something wrong because I could hear perfect. Now it feels like my balance is off. I can't hear y'all when I turn my head.
I tell the patient that they have an option to repair their eardrum and repair the hearing bones within their middle ear cavity. And I go over with them the anatomy of the middle ear, and I talk to them about the fact that a surgery can be performed to look into the middle ear, see what the problem is, and at the same setting to repair whatever it is.
Dr. Hahn knew exactly what he was doing, and he was taking it one step at a time. He wasn't, okay, well this is what we need to do, and then we need to do it now. He was doing it step by step by step. And the first step that Dr. Hahn took was taking an ear test. And when he had found out how bad the results were, that's when we started taking more steps towards getting surgery done.
I lifted up her eardrum, looked into her middle ear, and it was apparent that the 2nd hearing bone had actually been misplaced off of the 3rd hearing bone. So there was no connection between the 2nd hearing bone and the 3rd. When her eardrum would vibrate, it wasn't vibrating into the inner ear at all. We actually replaced her 2nd hearing bone with a prosthetic hearing bone, and within days, you know, she noticed a significant improvement in her hearing.
Amazing the results that I had, and ever since after the surgery, I mean, I've been just upscaling from there. If I knew someone who was having the same problem as I was, I would definitely recommend Dr. Hahn. He's a great physician, and he treats you like you're a person and not just another patient.
Well, that'll do it. That'll wrap up another edition of the Best Docs Network featuring Forest Park Medical Center. Of course, one of the best medical centers in all of the Dallas-Fort Worth area.
And for more information on the great Forest Park Medical Center, all their staff and surgeons and great equipment, head to the website, bestdocsnetwork.com. Click on the Forest Park Medical Center tab.
And if you have a question or comment for us, we would sure love to hear from you. Please send us an email at info@bestdocsnetwork.com.
There you go. So long, everyone. We'll see you next week.